So this is the new Mentor in a silicone implant, and it is the largest silicone implant to date approved by the FDA. Now the catch is approved for breast reconstruction only. So we have various size implants out there. This is 175 cc, and I can tell you that I've used implants this size for breast reconstruction and this size for breast reconstruction. And why does that differ from maybe the average size implant we would use for an aesthetic surgery? So this is about 370 cc's, which is more common for women that are seeking breast augmentation, because oftentimes the women that are coming in have some degree of breast tissue. So we're adding cc's to already the cc's of breast tissue she has. But there's been a huge gap in the need for a larger implant with breast reconstruction. Why? Because with breast reconstruction or mastectomies followed by breast reconstruction, the mastectomy takes away all of the breast tissue. So here we have zero breast tissue to add to an implant of this size. So this replaces the volume of the entire breast to augment it and get it back to something that might be fitting for a woman's body. Now, I've done reconstruction for well over 16 years, and everybody comes in all shapes and sizes, whether they're short or tall, whether they have broad shoulders or narrow shoulders. So someone, let's say, that is maybe 5'7", 5'8", and has extremely broad shoulders is going to carry a lot of breast tissue. And oftentimes we do this mastectomy, and before we had an implant like this, we'd have to overexpand a saline implant, because the largest silicone implant prior to this was about 800 cc's. And some women, you put an 800 cc implant in, and they still only had a B cup maybe. And that did not match their body habitus. And that was all we had to offer for them. So Mentor had been studying this for a number of years to finally get it approved by the FDA for breast reconstruction patients, because they are truly in need of an implant with this volume. Now, 1,240 cc's, so that's substantially bigger than the previous 800 cc implant, which I think is going to greatly benefit breast reconstruction patients out there.